Hello guys, welcome back to Brain Gist. Today I want to talk about an interesting concept, and that's how to prevent migraine headaches. I'm sure this concept may not be familiar to quite a number of people. You might be wondering, is it possible to ever prevent migraine headaches from happening? But actually, it is true. So in the clinic, it's a very common question I ask patients, and I believe virtually every neurologist asks the same question from patients who go headaches of any kind, be it migraine or other types of headaches. And that is, how many headaches do you have in a week or in a month? And then the answers are quite variable. So some tell you they have headaches every single day, or some have 1 or 2 headaches a month. But one of such headaches could last for 3 days before going away. So imagine the agony they go through for this period. Imagine that they have to cancel their appointments, miss important events because they're in pain, or sometimes they have to land in the emergency room to receive care. So, how do we prevent headaches and reduce the negative impact of these headaches on people's lives? And that's what I'm about to discuss in this video. In case you're new to the channel, it is Brain Gist, where we discuss neurological problems and how people can navigate them better and live better lives in spite of suffering these neurological disorders. So if you like the content, I ask you to not forget to subscribe, of course, leave your comments behind, give thumbs up and share, very importantly, so that others, your friends and families, can also benefit from these impactful videos. Right, so today I'm talking about headache prevention. So this concept is sometimes a bit difficult for patients to comprehend. How does this differ from your regular Panadol or ibuprofen that you take, or Immigrant that you take to treat your headaches when they happen? And what I say to try to pass the message across is, when you have headache, let's say you take ibuprofen, it may or may not help resolve that headache that you have at that particular time. And if it does succeed in eliminating that headache or that attack, but it doesn't stop you from having the next attack. So it just treats the headache, but doesn't go down to the underlying basis that generates the headache. But there are medications that are able to address the underlying biology of migraine headache, and that's what we refer to when we talk about preventative medications or migraine prophylaxis. So these are sets of medications that are able to work on that baseline proneness, or that very low threshold for headaches, and therefore make you less susceptible or less likely to have headaches. So they may not completely remove that risk of having headaches, but then they would substantially reduce the risk of those headaches happening. And we target about 50% reduction in headache numbers. So to start with, if someone has 15 headaches a month, then the target will be reducing it down to about 8 or 7 in a month. And that can actually make a lot of difference to their lives. So that's the entire concept. That's what the concept is about of migraine prevention. Now, does every singular migraine sufferer merit being put on migraine preventative medication? That's not the case. It's not everyone who needs it. We look at the headache numbers. We look at how severe these attacks are, what impact it has. There are people, for example, whose single headaches last for 3 days before resolving. And for those 3 days, they may be unable to function or participate in important events in their lives. So for such individuals, even though they have a single attack in a month, they might be candidates for preventative medications. But for straightforward, easy to treat headaches responding to simple analgesics, if the number is less than five, where we may or may not consider preventative therapy, depending on what the patient wants. But for those who have high headache numbers higher than five in a month, it's beginning to affect them, then we might begin to think about putting them on preventative medications. Or some people will have, migraine associated with paralysis on one side of their bodies, which can happen in migraine, or some other consequences, then would think these individuals might need, a preventative intervention. So this is the criteria we use in the clinic to decide who needs it and who doesn't need it. And of course, it's case by case. So we try to look at the risk versus the benefit. So these medications are completely different than the pain medications. And again, the other point is worth making is, what if you say, I've got 7 headaches, 8 headaches a month, and I can keep taking painkillers to take care of them, or even 15. The point is, if you overuse these medications, that can even potentially make your headaches worse in the first place. And then there are potential side effects to these medications if taken for too long, or if taken too frequently. So these can have effects on the organs in the body. And that is why preventative medications come in, and they can be quite useful. Now, we've got various options for preventative medications. So they can be tablets, which have to be taken every day. And that's why the patients have to be chosen carefully, because you might need to take medications on a daily basis. So you truly weigh the risk and the benefit. Be sure that the headaches themselves have so much impact as to warrant people taking pills every day. And then besides the tablets, there are injectable medications as well, which can be injected once a month. And then, of course, this can be expensive. And then we've got other options like some injections around the head, like blocking the nerves around the head, which we do perhaps every 3 weeks or so. This is particularly very useful in pregnancy, when some of these preventative medications can't be safely used because of potential risk of harm to the unborn baby. So in such situations, we might resort to these blocks if headaches are troublesome in pregnancy. And then Botox is another option that we inject around specific points around the head, and we tend to do that every 3 months. So this is what migraine prevention is all about, and I do hope you learned something, and I encourage you to share with friends, families, so that they can also benefit from that video. And of course, do not forget to subscribe. So thank you for watching until the end, and I hope to see you in my next video. Until then, goodbye and continue to stay safe.